Dr. Basil and Angie, the dental assistant, have taught me so much valuable information on orthodontics. I learned about all aspects of orthodontics, from organizing patients, scheduling them, insurance, and of course, the many processes of aligning teeth. I started out my mentorship pulling patients' files for their upcoming appointments. Each patient's file usually consists of x-rays, pictures, and a treatment plan. At Basil Orthodontics, each patient is welcomed by the welcome board. While the patient and their parents wait for the appointment, they are offered cold water and can watch TV, read magazines, play with the Lego wall, or even enjoy Dr. Basil's train tracks that run along the ceiling throughout the whole office. Dr. Basil also has a board that recognizes all his patients that are in the newspaper. Dr. Basil was even nice enough to post articles about me on the board. Dr. Basil's hospitality creates a very relaxing environment for the patients and their families. When starting a new treatment plan, Dr. Basil has to take x-rays of the patient's jaw and teeth. This helps show Dr. Basil which way the teeth are growing and how they are positioned. After the x-ray, Dr. Basil takes a mold of the patient's teeth. These molds are used to create retainers at the end of the treatment. There are many different types of treatments, such as Invisalign, which is made up of numerous virtually created trays that straighten out the teeth, or standard braces, which can have clear brackets for more aesthetically pleasing appearance, or metal brackets. Patients can also choose to have the brackets behind their teeth, which is considered more aesthetically pleasing as well, but Dr. Basil does not use this type of treatment very often. Dr. Basil uses many different utensils and electronics while putting on braces. This is a picture of an LED light that is used to solidify the brackets onto the teeth. Dr. Basil also uses water to rinse the mouth, air to dry the teeth, and a suction to pick up excess saliva. If a patient has metal brackets, they have the option of choosing which color rubber bands they would like to use. During my mentorship, Dr. Basil let me practice on fake teeth models by taking off the rubber bands, removing the wire, and reapplying the rubber bands, just so I could get a feel of how important dexterity is to being an orthodontist. Applying the wire and the rubber bands was a lot harder than it looks. Once the patient's treatment plan is done, they follow up with a retainer. Some orthodontists send their patients molds in and get them made, but at Basil Orthodontics, Dr. Basil makes the retainers himself. During my mentorship, it was very interesting watching Dr. Basil make retainers because it seemed like it required so much talent to maneuver the wires into the perfect position. Dr. Basil even makes retainers with fake teeth built in just in case a patient is missing teeth. Dr. Basil also makes mouth guards, and he was nice enough to help make me a mouth guard for myself that I use for hockey. Throughout my time with Dr. Basil, I have learned so much about orthodontics. Working with Dr. Basil has not only provided me with a wonderful experience, but it has also made me so excited to enter the pre-dental program next year and prepare me for dental school in the future.